Hi friends and welcome to KANIKA'S Nursing Academy. I am Kanika and today I am here to discuss with you about the solutions with rationals of the scholarship exam which we have conducted for all of you on 26th of August, and the results for the same have been displayed last night itself. And today this video will be having a compilation of all the questions from 1 to 100, 75 questions of the nursing part and 25 questions from the GK reasoning part, and we will be me and my colleagues will be discussing with you about the solutions with their rationale. So quickly starting with the scholarship test, solved scholarship test. Before that I would like to share with you all that we conduct the scholarship exam after every 3 months. The last exam was held in May 2020 and this time in August, and next will be conducted in the month of November or December 2020. So just be ready for the same. So just going ahead, this is the question number 1, and the question number 1 was the nurse has to administer an iron injection to an adult. How this injection should be administered was the question, and the options were subcutaneous, intravenous, intramuscular and Z-track intramuscular. The iron preparation is a very thick preparation or a viscous preparation, so it cannot be administered by the subcutaneous or intravenous route. So it is administered by the intramuscular route, but from the intramuscular also there are two options, either by the 90-degree, that is a straight needle method, or by the Z-track intramuscular, that is making a skin flap in a Z manner and injecting the injection deep inside the muscle. So let us see the answer. It is correct option is D, that is a Z-track intramuscular. The rationale for the same is this method of injection administration prevents the irritation of skin and the leakage of medication from the injected area. So the second question is Miss Smriti needs instruction on the medications she is taking for her hypothyroidism, and for this what teaching we have to include in her teaching plan. Just remember, we are talking about the medication teaching regarding the medications, so it is not about the disease condition. So let us see the options what they say. Take medications with meals or with food, take medications in the evening or at bedtime, report excess weight loss and leg cramps, increase the use of iodized salt and spinach. So for on first instance you would say that yes, because it is hypothyroidism, iodized salt has to be administered to this patient and spinach can also be taken. Then we do, because I already mentioned that it is about the medication treatment and the medication therapy, it can be about the therapeutic effects or the side effects. So let us see what the option says. Answer says the correct answer is C. The correct answer is the correct answer for this is C, and the rationale says that anti-thyroid drugs, they are administered early morning before taking meals, just to increase or enhance the metabolism or absorption, and its toxicity leads to weight loss and leg cramps. So the excessive weight loss and leg cramps are to be included in the teaching plan when the patient is put on the medications for hypothyroidism, and the patient cannot take the meals with food, and the medications cannot be taken at the evening or at bedtime, and because we have mentioned that they are to be taken early morning, okay, before the meal. Next, question number 3. The question number 3 is, in the following which is not a disturbance of consciousness. So it was a comparatively easy question. Consciousness, the options were stupor, grandiosity, confusion and coma. And if we see the answer as, correct answer as B, the rationale for the same is stupor, confusion and coma are the altered level of consciousness, whereas the grandiosity is a type of delusion, okay, which is not a disturbance of consciousness. So all stupor, confusion and coma are the alterations of consciousness, but not the grandiosity. Moving to the next question. So question number 4, and it says Sakshi has been experiencing regular coordinated contractions with cervical dilation moving from 4 to 6 centimeter in the last half an hour. 4 to 6 centimeter of cervical dilation, and her membranes are still intact. So we have to answer that the Sakshi patient is in which stage of labor. The options are latent phase of first stage, active phase of first stage, third stage, second stage. We all know what the stage is: first stage, second stage, third stage of labor. And since she is experiencing contraction, so we have to see that she would be in first stage of labor. But in first stage, what phase, whether it is latent or whether it is active. So let us see what the answer says, and I will explain the rationale also. So answer says B, that is active phase of the first stage of labor. In active phase, normal cervical dilation is 4 to 7 centimeter and the contractions come at every 4 to 5 minutes. See, what is the difference between latent and active phase? In latent phase also, the mother, antenatal mother, experiences the contractions at regular intervals, but there is a very slow dilation of the cervix. But here the dilation of the cervix is also taking place at a faster pace. So the correct answer is B. Let's move to the next question, number 5. All are true about the measles except incubation period is 10 to 14 days, secondary attack rate of 30%, more severe in malnourished children, and it has subclinical infection. So I would just say that it has incubation of 10 to 14 days, it is more prevalent in the malnourished people or malnourished children, and it is a subclinical infection. That means it is not having definitive characteristics to be called as a infection. Let us see the answer. Correct answer is B. Secondary attack of measles is 60%. So here it was written as 30%, which was incorrect. So correct option is 60%. Moving to the next question, question number 6. And the question says, the nurse leads an adolescent health information group which often expands into other areas of discussion. She knows that these youths are trying to find out who they are, and discussion often focuses on which directions they want to take in school and life, as well as peer relationships. So according to Eriksen theory, which is this stage? And it is very clearly understood that this is the stage of identity versus role confusion. In the adolescent stage, they are neither counted as children nor as adults. So they are discussing about that thing only. Others are the incorrect options. You can see the correct answer is A. And the psychosocial development of theory of Eriksen says that identity versus role confusion is found in the adolescent age group. So next question number 7 is, objective data might be including what thing? Objective data means in assessment we have subjective and objective assessment. Subjective is something which the patient says I am having, and objective is something which we observe. So here we can see that chest pain is there, complaint of dizziness, evaluation of blood pressure, or none of the above. So the answer would be C, that is evaluation of blood pressure, which is an objective assessment. We will be going and observing or taking the measurement. It is not the patient is telling that my blood pressure is that. So correct answer is evaluation of blood pressure is an objective assessment data. Question number 8, a second year nursing student has just suffered a needle stick injury while working with a patient who was positive for AIDS, and the question is, which of the following is most important action that the nursing student should take? So immediately see a social worker, start prophylactic azathioprine treatment, start prophylactic pentamide treatment, or seek counseling. So the answer here says that the correct option is B, start prophylactic azithromycin or azathioprine treatment, and the rationale for the same is we all have to know this, that the risk for getting HIV infection after any needle stick injury occurs is 1 in every 300 needle stick injuries. So if any student nurse or the nurse has suffered with this injury, the most important action is to start immediately the prophylactic therapy of AZT treatment. So this is about the 8th question. Next is the question number 9. Hallucination is a disorder of perception, consciousness, memory, or thought. Again, it is an easy question to answer because hallucination, we know it is a disorder of perception. Next is the question number 10. Sampling method which involves a random start and then proceed with the selection of every k element from the then onwards, that is k, where k is population size oblique the sample size. The options given are simple random, stratified, systematic or snowball. Correct answer is systematic sampling, and the rationale for the same is there is a particular formula for having a system. For example, if from a population of 10,000 we have to seek a sample of 100, so what will be the k? It will be 100. So every 100th person will be taken. If the sample 1000 has to be taken from 10,000 wali population, then the answer would have been every 10th person. So there is a system which follows, that is why it is known as systematic random sampling. Next is question number 11. The epithelial tissue which is found in the uterine tube is squamous, ciliated, columnar, simple, and the answer is B, that is ciliated. So uterine tubes are lined with the ciliated epithelial layer. Next question is, which of the following is a characteristic posture of pregnancy? Whether it is kyphosis, it is hyperextension, it is lordosis, or it is scoliosis. So the correct answer here is that the female or the antenatal mother will be having a lordosis posture of the back, which is lordosis posture of the back, that during pregnancy the spinal cord of the pregnant women gets L shaped, which we call as lordosis, L for lordosis, and the spine takes the position of the L shape, that is why it is known as lordosis. So next, moving to the question number 13. Fluoroquinolones are not effective against is the question, and the options are Pseudomonas, Clostridium difficile, Klebsiella or Proteus, and the correct answer here is B, because it is a gram positive bacteria. The Clostridium difficile, it is a gram positive and it is also resistant to fluoroquinolones, so that is why fluoroquinolones are not effective against these species. Next, question number 14. Eriksen developmental theory is different from Freud's theory in that Eriksen placed a greater emphasis on, we have just seen about one other question of the Eriksen theory, the cultural factors in development, the instinctual drive, the interpersonal relations, or the psychosexual development. So the correct answer here is A, that Eriksen mainly placed emphasis on the cultural factors in the development, whereas Sigmund Freud has put greater emphasis on the psychosexual development of the children. So this is about the question number 14. Next, question number 15. Which of the following interventions would be most important for determining the fluid balance in a client with end stage renal failure? Monitoring the urine specific gravity, measuring the fluid intake and output, weighing daily or record frequency of the bowel movements, and the correct answer here is C, that is measuring the fluid, C answer, that is weighing the patient daily. Why taking the patient's weight is very important, because if we want to determine the exact intake and output or the fluid overload in the patient, it is very important to take the weight of the patient at every day at the same time. Okay, so this is the correct answer, weighing the patient daily. Next question is, 44-year-old female client had an emergency cholecystectomy 3 days ago for a ruptured gallbladder. The client has the client is experiencing pain, abdominal rigidity, distension, increased temperature, tachycardia and an elevated white blood count. And what do we suspect that the patient might be having? Whether it is gastritis, whether evisceration has occurred, whether it is peritonitis or a pulmonary embolism. So we can rule out gastritis or evisceration here with these complaints, because the answer here is C, that is peritonitis. The important complication of ruptured gallbladder is peritonitis only, and the main symptoms of peritonitis are abdominal pain, rigidity of abdomen, distension, increased body temperature and increased WBC count along with tachycardia, and all these symptoms have been mentioned in this particular question. So the 17th question, disorder of motor activity in which the person constantly maintains a position without any movement is known as mannerism, catalepsy or cataplexy, verbigration or negativism. So answer is B, that is cataplexy or catalepsy, where the patient assumes a waxy posture. The person remains in a similar posture for longer period of time, and it is a disorder of motor activity. Let us move to the 18th question, that is, which of the following method would be avoided for a woman who is 38 years old, has 3 children and smokes a pack of cigarette per day. That means we are talking about which of the following contraceptive methods have to be avoided in this particular female having such history. So the options are oral contraceptives, cervical cap, diaphragm or insertion of IUD, and the answer is A, that is oral contraceptive agents should be avoided in this particular female who has this history, because these pills are contraindicated in those women who smoke cigarette, because it has shown increased risk for thrombophlebitis. So there might be a chance that the female gets a thrombophlebitis. So that is why it is to be avoided. Next is 19th question, and the question says infections primarily of animals that can be transmitted through milk is all except tuberculosis, brucellosis, Q fever or malaria, and the answer here, correct answer here is malaria. Malaria is transmitted by Anopheles mosquito, that we know, and it is not transmitted through milk, but other infections can be transmitted through the ingestion of milk. So correct answer here is malaria. Next is the state of complete disorganization and confusion which lead to loss of identity and direction is known as equilibrium, bargaining, chaos or resistance. Complete disorganization and confusion means what? It is a chaos-like situation. Chaos-like situation is something where the two people or two parties are having bargaining, negotiation, but none is agreeing to the other party's decisions or the thoughts. Then the chaos is created. It is simply a state of complete disorganization and confusion which leads to loss of identity and direction. Next question. A clinic nurse provides information to the mother of a toddler regarding toilet training. It is very important topic. Which statement by the mother indicates that she requires further teaching? The option here are bladder control usually is achieved before bowel control. The child should not be forced to sit on the potty for long periods. The ability of the child to remove clothing is a sign of physical readiness. The child will not be ready to toilet train until the age of about 18 to 24 months. So we have been asked from which of these following statements we will be determining that the mother needs further teaching. So if she says the child will not be ready for the toilet training until the age of about 18 to 24 months, that means she is fine, she knows the things. If she says the ability of the child to remove the clothing is a sign of physical readiness, then also she is okay, she knows about the toilet training. If she says that the child should not be forced to sit on the potty for long periods, then also she is correct in saying this. But if she says that bladder control is achieved before bowel control, she is not correct. She needs further training. Usually bowel control is achieved before the bladder control occurs. So here we can just see bowel control and bowel, bladder. First of all, the child will be achieving bowel control at night time, then bowel control at the daytime, then the child will have the bladder control during daytime, then in the end the bladder control at night time will be attained by the child. So 24, it is a very rare information that only 25% of the children, they get toilet trained at the age of 24 months, and about you can say 50 to 60% at the age of 30 months, and 98% of the children, they get toilet trained by the age of 3 years. So moving to the next question. So answer here is A, that she needs further teaching. Question number 22. When recording blood pressure, the sounds which can be heard with the stethoscope placed over the artery is termed as, it is very easy. This is not wheezing, this is not murmur, these are abnormal sounds. Corticough sounds is a normal sound which we hear while taking the blood pressure. So answer here is D. These are the sounds which are heard because the blood flow is going through the artery where we have kept our stethoscope diaphragm. So next question is, a client had hemicolectomy performed 2 days ago, and now today what is happening? The nurse is assessing the patient and the incision and discovered that small part of the abdominal viscera is protruding through the incision, and this complication of the wound healing is termed as, is it excoriation? Excoriation is the skin peeling, it is not excoriation. Is it dehiscence, wound dehiscence? Let us just find out. Is it decortication? It cannot be decortication, but is it evisceration? Let us see what the answer says. Answer is D. So what is the difference? Let us see. Excoriation is a chronic skin picking or dermatillomania. It is characterized by repeated picking at one's own skin which results in the skin lesion. So it was not the correct answer. And another is dehiscence. It is a wound opening either partially or completely, and when the organ comes out of that wound opening, that is known as evisceration. So this is the basic difference between evisceration and dehiscence. Question number 24. Perception of a stimulus in the absence of an actual stimulus is known as illusion, hallucination, verbigeration, delusion. Illusion is perception of a stimulus in the absence of a stimulus, so it cannot be the correct answer. Hallucination is the perception of a stimulus in the absence of an actual stimulus. And let us see. So what I was saying, the perception of a stimulus in the presence of an actual stimulus is illusion, and hallucination is perception of a stimulus in the absence of actual stimulus, whereas misperception of the stimulus in the presence of an actual stimulus is known as illusion. Delusions are the fixed false beliefs about somebody, and verbigeration is the repeated words or phrases in a particular disorder. And earlier I was mentioning that stimulus, that perception of a stimulus in the absence of an actual stimulus is a hallucination. But if a stimulus is present and it is perceived in a different manner, like a rope is perceived as a snake, that will be illusion. But if something is not present and somebody is able to hear or see something, that will be a hallucination. So the last question from my part is, which of the following is not a part of the product of conception? The options are decidua, amniotic fluid, fetus, membranes and placenta. Again easy question to answer. These three are the products of conception, but this is not the product of conception. So the answer is decidua, which is a layer of the uterine gravid uterus. So the option or the answer here was the deciduous, which is not a product of conception. So here I finish with my part of questions, and rest of the questions will be discussed by my colleagues one by one to make the solution of the question clear to you. Thank you.
Hello everyone, this is Kavita Thakur. I am teaching faculty of KANIKA'S Nursing Academy. So now next question is, discoloration of teeth is caused by a kind of antibiotic called. So right answer is tetracycline, because tetracycline जो है वो कैल्शियम के साथ बाइंड कर जाती है, कैल्शियम के साथ बाइंड करने की वजह से टेट्रासाइक्लिन की वजह से होती है टूथ स्ट्रेनिंग. एंड टेट्रासाइक्लिन जो एक टाइप, ये आपकी बैक्टीरियोस्टेटिक ड्रग है आपकी. Now next question is, which of the following should the nurse do first after noting that a child with Hirschsprung disease has a fever and watery explosive diarrhea? So right option is A, because Hirschsprung disease में जब यहाँ पे डायरिया होता है तो डायरिया की वजह से यहाँ पे severe dehydration होने के chances होते हैं. So now next question is, नेक्स्ट क्वेश्चन इज विच ऑफ द फॉलोइंग एथिकल प्रिंसिपल रेफर टू द ड्यूटी नॉट टू हार्म. सो राइट आंसर इज B, that is non-maleficence. So non-maleficence means do not harm or to prevent harm, and beneficence means to provide maximum benefit to the patient, and fidelity means to be faithful for your own commitment and promises, and veracity means to tell truth, to be honest. Now next question is a client returned to the cardiovascular intensive care unit following a coronary artery bypass graft. In planning the client's care, the most important electrolyte to monitor is potassium. So जब हम CABG करते हैं तो उसके बाद जो ड्रग्स हम देते हैं, AC इनहिबिटर देते हैं, बीटा ब्लॉकर्स वगैरह देते हैं, तो उसकी वजह से वहाँ पे उसके डायूरेटिक इफेक्ट की वजह से यहाँ पे हाइपोकैलेमिया होने के चांसेस रहते हैं. इसलिए यहाँ पे मेनली यहाँ पे पोटाशियम के लेवल को मॉनिटर किया जाता है. और वैसे भी सर्जरी के बाद पोटाशियम का लेवल वहाँ पे डिक्रीज या एलिवेट होने के चांसेस होते हैं, इसलिए भी वहाँ पे पोटाशियम के लेवल को चेक करते हैं, बिकॉज हाइपोकैलेमिया एंड हाइपरकैलेमिया कैन कॉज डिसरिथमिया. So now next question is behavioral objective model is also referred as. So right option is product model. So product model also called as behavioral objective model or Tyler model, and this model is introduced in 1949 by Ralph Tyler. Now next question is the pregnant woman with her LMP is 1 July 2019. The expected date of delivery is. So right option is B. सो राइट ऑप्शन इज बी. तो यहाँ पे नीगल फार्मूला जो है यूज़ किया है. सो नीगल फार्मूला के अकॉर्डिंग हम क्या करते हैं, यहाँ पे फर्स्ट डेट ऑफ जो LMP होती है उसके साथ हम क्या करते हैं 7 डेज प्लस करते हैं प्लस 9 मंथ. सो फॉर एग्जांपल यहाँ पे जो LMP है दैट इज़ 1 जुलाई 2019. सो 1 जुलाई में हम क्या करेंगे, यहाँ पे 7 डेज को पहले प्लस करेंगे, तो 1 + 7 दैट इज़ 8. सो 8 हो गया यहाँ पे, ठीक है, 8 अगस्त. तो उसके आगे हम 9 मंथ्स को प्लस करेंगे. सो वहाँ पे आंसर क्या होगा, 8 अप्रैल 2020. Now next question is which of the following antibiotic is specifically effective against anaerobic bacteria. So right answer is C. So सिंपल सी बात है यहाँ पे कि जो मेट्रिंडाजोल है वो आपकी मोस्ट कॉमनली जो आपकी हम मेडिकेशन यूज़ करते हैं हम एनारोबिक बैक्टीरियाज के इन्फेक्शंस को ट्रीट करने के लिए, और बाकी जो मेडिकेशंस है वो हम यूज़ करते हैं एरोबिक बैक्टीरियाज के इन्फेक्शन को ट्रीट करने के लिए. नाउ नेक्स्ट क्वेश्चन इज patient with idiopathic thrombocytopenic purpura have increased risk of bleeding, therefore the nurse must carefully monitor. तो यहाँ पे राइट ऑप्शन जो है दैट इज डी, बिकॉज इडियोपैथिक थ्रोम्बोसाइटोपेनिक पुरपुरा में इसमें क्या होता है, इडियोपैथिक मीन्स विदाउट एनी कॉज, थ्रोम्बोसाइटोपेनिक मीन्स यहाँ पे प्लेटलेट या थ्रोम्बोसाइट्स का काउंट डिक्रीज कर जाएगा जिसकी वजह से वहाँ पे पुरपुरा होगा. तो यहाँ पे राइट ऑप्शन के अकॉर्डिंग यहाँ पे प्लेटलेट काउंट एंड आरबीसीज को चेक इसलिए करते हैं क्योंकि इस कंडीशन में इडियोपैथिक थ्रोम्बोसाइटिक पुरपुरा में थ्रोम्बोसाइट का लेवल डिक्रीज हो जाता है जिसकी वजह से वहाँ पे ब्रूजिंग हो जाती है, ब्लीडिंग हो जाती है एंड जगह जगह वहाँ पे पुरपुरा पैचेस बन जाते हैं वहाँ पे. सो next question is a 47-year-old client is admitted for colon surgery. Intravenous antibiotics are started 2 hours prior to surgery even though the client has no known infection. The reason for giving antibiotic prior to surgery is. तो सिंपल सी बात है, जो रीज़न होता है एंटीबायोटिक के देने का, एंटीबायोटिक्स हम क्यों देते हैं, टू प्रिवेंट इन्फेक्शन. इन्फेक्शन को प्रिवेंट करने के लिए हम एंटीबायोटिक्स देते हैं. नेक्स्ट क्वेश्चन इज lactate ringer solution is contraindicated in. So lactate ringer solution is contraindicated in lactic acidosis, क्योंकि ringer lactate solution जो है अगर हम lactic acidosis वाले पेशेंट को देंगे तो वहाँ पे एसिडोसिस और ज़्यादा होने के चांसेस हो जाएंगे, लैक्टिक एसिडोसिस और ज़्यादा वहाँ पे इंक्रीज करेगा, एग्रीवेट करेगा. तो इस केस में हम ringer lactate solution को इसमें यहाँ पे अवॉइड करते हैं या contraindicated होता है. एंड ringer lactate solution also known as Hartmann solution, and ringer lactate solution it is a type of isotonic solution. Now next question is a 9-year-old is admitted with suspected rheumatic fever. Which finding is suggested of polymigratory arthritis? So right option is D. So सिंपल सी बात है, पहली चीज़ तो rheumatic fever होता क्या है. So rheumatic fever में क्या होता है, rheumatic fever is caused by beta hemolytic streptococci. तो rheumatic fever में क्या होता है, मेन यहाँ पे कौन सा क्राइटेरिया हम यूज़ करते हैं, जोन्स क्राइटेरिया इज यूज्ड. सो यहाँ पे इसके मेजर क्राइटेरिया में आता है पॉलीमाइग्रेटरी अर्थराइटिस. अब पॉलीमाइग्रेटरी अर्थराइटिस में क्या होगा कि यहाँ पे 2 या 2 से ज़्यादा जॉइंट की जब इन्फ्लेमेशन हो जाती है और जब वो एक जॉइंट से दूसरे जॉइंट की तरफ माइग्रेट करता है तो उसको हम बोलते हैं पॉलीमाइग्रेटरी अर्थराइटिस. ठीक है, तो यहाँ पे सिंपल बोलेंगे कि इसके साइन एंड सिम्टम क्या होते हैं पॉलीमाइग्रेटरी अर्थराइटिस के, दैट इज स्वेलिंग, इन्फ्लेमेशन एंड इफ्यूजन ऑफ जॉइंट एंड स्टिफनिंग भी कॉज करता है ये. ठीक है, एंड और रूमेटिक फीवर की जो ड्रग ऑफ चॉइस है दैट इज बेंजाइल पेनिसिलिन. पेनिसिलिन इसमें मोस्ट कॉमनली यूज़ करते हैं स्ट्रेप्टोकोकल इन्फेक्शन को ट्रीट करने के लिए. सो नाउ नेक्स्ट क्वेश्चन इज द एसेंशियल फैटी एसिड दैट मस्ट बी डिराइव्ड फ्रॉम द डाइट आर. सो राइट ऑप्शन इज सी. Right option is C because linoleic acid and alpha linoleic acid these are essential fatty acid. अब essential fatty acids क्या होते हैं? essential fatty acid वो acids होते हैं, वो fatty acid होते हैं जो हमारी बॉडी सिंथेसाइज नहीं करते हैं, जो हमारी बॉडी सिंथेसाइज नहीं करती है, जो हम डाइट के थ्रू लेते हैं. सो एसेंशियल फैटी एसिड का टोटल नंबर जो है दैट इज 9 होते हैं और नॉन एसेंशियल फैटी एसिड जो 11 नंबर में होते हैं जो हमारी बॉडी में सिंथेसाइज होते हैं. सो एसेंशियल फैटी एसिड जो है वो लिनोलिक एंड जो अल्फा लिनोलिक एसिड है ये दोनों आपके एसेंशियल फैटी एसिड में आते हैं. और बाकी उसके अलावा जो ए ऑप्शन है, बी ऑप्शन है, डी ऑप्शन में जो यहाँ पे ये दिए हैं ये हैं आपके नॉन एसेंशियल फैटी एसिड. सो नेक्स्ट क्वेश्चन इज ड्यूरिंग विच ऑफ द फॉलोइंग फेज ऑफ मेंस्ट्रुअल साइकिल इज इट आइडियल फॉर इम्प्लांटेशन ऑफ अ फर्टिलाइज्ड एग टू अकर. अब यहाँ पे राइट ऑप्शन जो है दैट इज डी, दैट इज सिक्रेटरी फेज. अब यहाँ पे सिंपल सी बात है, सिक्रेटरी फेज इज ऑल्सो नोन एज ल्यूटियल फेज. सो सिक्रेटरी फेज जो होता है आपका ल्यूटियल फेज जो होता है इसकी टाइमिंग रहती है 15 to 28 डेज तक ये होता है. और इस केस में ल्यूटियल फेज के ड्यूरिंग क्या होता है यहाँ पे जो एम्प्टी ग्राफियन फॉलिकल होता है आफ्टर ओव्यूलेशन, जो एम्प्टी ग्राफियन फॉलिकल है वो क्या करता है अंडर द इन्फ्लुएंस ऑफ एलएच वो डेवलप हो जाता है इनटू कॉर्पस ल्यूटियम. फिर जो कॉर्पस ल्यूटियम है ये क्या करेगा, प्रोजेस्टेरोन एंड एस्ट्रोजन की सिक्रेशन को क्या करेगा, इंक्रीज करेगा. और इस फेज में क्या होगा, फिर बाद में उसको ये क्या करेगा, एंडोमेट्रियम लेयर को और ज़्यादा क्या करेगा, सिक्रेटरी बनाएगा, उसको एडेमेटस बनाएगा. और जिसकी वजह से बात क्यों बना रहा है उसको ज़्यादा एडेमेटस एंड सिक्रेटरी फॉर द अपकमिंग प्रेगनेंसी और इम्प्लांटेशन. तो इसलिए इम्प्लांटेशन तो सिंपल सी बात है यहाँ पे इस क्वेश्चन के अकॉर्डिंग यहाँ पे सिर्फ इतना आप लोगों ने याद रखना है कि जो इम्प्लांटेशन जो होती है वो होती है सिक्रेटरी फेज ऑफ मेंस्ट्रुअल साइकिल में. ठीक है. नाउ नेक्स्ट क्वेश्चन इज कल्चर मीडिया इज स्टरलाइज्ड बाय विच ऑफ द फॉलोइंग मेथड. सो कल्चर मीडिया को हम स्टरलाइज करते हैं बाय यूजिंग ऑटोक्लेव. सो ऑटोक्लेव क्या होता है आपका, किस प्रिंसिपल के अंडर वर्क करता है. ऑटोक्लेव का प्रिंसिपल ये इसका जो प्रिंसिपल होता है दैट इज स्टीम अंडर प्रेशर. और ऑटोक्लेव जो है वो एक तरह की आपकी मॉइस्ट हीट एप्लीकेशन है जिसमें हम कितना टेम्परेचर मेंटेन करते हैं दैट इज 121 डिग्री सेल्सियस टेम्परेचर और वो करते हैं फॉर 20 to 30 मिनट्स. सो कल्चर मीडिया के लिए हम यूज़ करते हैं ऑटोक्लेव. ठीक है. नाउ नेक्स्ट क्वेश्चन इज सो यहाँ पे करेक्ट आंसर ए है. नाउ नेक्स्ट क्वेश्चन इज विच ऑफ द फॉलोइंग इंटरवेंशन इज नॉट रिकमेंडेड इन वाटरी डायरिया. सो वाटरी डायरिया में हम इंट्रावीनस एल्ब्यूमिन नहीं देते हैं. ये यहाँ पे स्ट्रिक्टली कॉन्ट्रा इंडिकेटेड होता है बिकॉज अगर हम यहाँ पे इंट्रावीनस एल्ब्यूमिन देंगे तो वो क्या करेगा, उसकी कंडीशन को क्या करेगा, एग्रीवेट करेगा मतलब डायरिया को क्या करेगा, इंक्रीज करेगा. बिकॉज एल्ब्यूमिन खुद एक प्लाज्मा वॉल्यूम एक्सपेंडर है. ठीक है. और जो एल्ब्यूमिन होता है जब भी हम एल्ब्यूमिन देते हैं पहली चीज़ तो ये हमेशा स्लो रेट पे देते हैं. और दूसरी चीज़ इसमें इंपॉर्टेंट जो कॉम्पिटिटिव वे से जो इंपॉर्टेंट है कि एल्ब्यूमिन हमेशा जब भी हम एल्ब्यूमिन देते हैं उस टाइम पे हम फ्लूइड को रिस्ट्रिक्ट करते हैं और स्लो रेट पे देते हैं. ठीक है. सो नेक्स्ट क्वेश्चन इज A 25-year-old client is admitted for a tonsillectomy and informs the nurse of having had episode of muscle cramp, weakness and an unexplained temperature elevation. Many years ago, the client's father died shortly after surgery subsequent to developing a high fever. The surgeon has ordered dantrolene sodium prophylactically prior to the tonsillectomy to reduce the risk of malignant hyperthermia. तो सिंपल सी बात है, तो इस केस में मैलिग्नेंट हाइपरथर्मिया को प्रिवेंट करने के लिए सर्जरी के बाद मैलिग्नेंट हाइपरथर्मिया ना हो तो इसलिए पेशेंट को ऑलरेडी यहाँ पे डेंट्रोलिन सोडियम देते हैं जो कि एक मसल रिलैक्सेंट है जिसकी वजह से वहाँ पे मैलिग्नेंट हाइपरथर्मिया होने के चांसेस कम होते हैं जिसकी वजह से पेशेंट की फिर डेथ भी नहीं होगी. सो नेक्स्ट क्वेश्चन इज विच ऑफ द फॉलोइंग साइन एंड सिम्टम आर कैरेक्टरिस्टिक ऑफ मिनिमल चेंज नेफ्रेटिक सिंड्रोम. सो नेफ्रेटिक सिंड्रोम जो होता है इसमें क्या होता है, मिनिमल वहाँ पे चेंजेस होते हैं. ठीक है. इसमें क्या होगा, मिनिमल चेंज मतलब ये क्या होगा, नेफ्रोटिक सिंड्रोम से कैसे डिफरेंट है. नेफ्रोटिक सिंड्रोम में क्या होगा, वैसे तो ये ऑलमोस्ट सेम है बस ये कि थोड़ा थोड़ा डिफरेंस होता है दोनों में. जो नेफ्रोटिक सिंड्रोम में ज़्यादा डैमेज होता है, मैक्सिमम डैमेज होता है, और जो नेफ्राइटिक सिंड्रोम में होता है मिनिमम डैमेज. ठीक है. तो इसमें जो आपका राइट ऑप्शन है दैट इज सी. ठीक है. कि नेफ्राइटिक सिंड्रोम में क्या क्या साइन एंड सिम्टम होंगे, पुअर एपेटाइट, प्रोटीन यूरिया एंड अडीमा. जबकि हाइपरटेंशन, अडीमा एंड प्रोटीन यूरिया जो होगा आपका ये होगा नेफ्रोटिक सिंड्रोम में. नाउ नेक्स्ट क्वेश्चन इज अ 23-year-old पेशेंट एमिनोरिक फॉर 16 weeks had vaginal spotting. She was found to have a uterus enlarged to 20 weeks size and no fetal heart sound audible with the Doppler or fetoscope. Human chorionic gonadotrophin serum levels were approximately 150 international units per ml. Which of the following test is most appropriate at this time? तो इस टाइम पे जो appropriate जो टेस्ट होगा दैट इज सीरियल एचसीजी। तो इसमें एचसीजी के लेवल को चेक करेंगे, क्योंकि जब भी प्रेगनेंसी, अगर नॉर्मल प्रेगनेंसी तो एचसीजी क्या होता है, एवरी 24 to 48 आवर डबल हो जाता है, इंक्रीज करता है, एवरी 24 to 48 आवर डबल होता है। पर अगर एबनॉर्मल प्रेगनेंसी है वहाँ पे, तो वहाँ पे वो क्या होगा, डबलिंग नहीं होगी वहाँ पे, जिसकी वजह से वहाँ पे क्लियरली पता चलेगा कि वहाँ पे कि एबनॉर्मल प्रेगनेंसी है। तो इसलिए हम करते हैं यहाँ पे एचसीजी का लेवल हम चेक करते हैं। तो एचसीजी के रिगार्डिंग भी यहाँ पे कई सारे क्वेश्चन आते हैं कि एचसीजी जो होता है, ह्यूमन कोरियोनिक गोनाडोट्रोपिन हार्मोन, इज सिक्रेटेड बाय which tissue or which organ? So HCG is secreted by syncytiotropoblast layer। जो प्लेसेंटा की syncytiotropoblast layer होती है वो HCG को सिक्रीट करती है। नेक्स्ट क्वेश्चन यहाँ पे आता है कि जो HCG होता है कि वो किस टाइम पे वो यूरिन में और ब्लड में अपीयर होना स्टार्ट हो जाता है। तो वो यूरिन में या सिक्रीशंस में वो प्रेजेंट होता है 8 to 9 days आफ्टर फर्टिलाइजेशन। एंड नेक्स्ट क्वेश्चन यहाँ पे आता है कि जो HCG है कि वो कितने टाइम बाद वो डिसअपियर हो जाता है। तो ये 2 वीक आफ्टर डिलीवरी ये डिसअपियर हो जाता है। तो ये सारे मेन क्वेश्चंस है एचसीजी के रिगार्डिंग, ठीक है। सो नाउ नेक्स्ट क्वेश्चन इज सडन स्टिमुलस कॉजेज द आर्म टू फ्लाई अप एंड आउट इज। सो राइट ऑप्शन इज मोरो रिफ्लेक्स। तो सिंपल सी बात है, मोरो रिफ्लेक्स में क्या होता है, नॉर्मल जो रिएक्शन होता है बेबी का वो क्या होता है, जैसे हम बेबी को, जैसे बेबी के पास क्या ज़्यादा साउंड आएगा तो वो क्या करेगा, एबडक्शन ऑफ लिम्स, एक्सट्रीमिटीज को क्या करेगा, एबडक्ट करेगा, मतलब सी शेप्ड आर्म्स करेगा, दैट इज मोरो रिफ्लेक्स, ठीक है। तो मोरो रिफ्लेक्स में क्या होता है, ये कितने टाइम तक आपका कितने टाइम बाद डिसअपियर होता है, तो इसको बोलते हैं कि ये डिसअपियर होता है आफ्टर 4 to 6 month। मेनली ये 4 month तक आपका रहता है, ठीक है, उसके बाद डिसअपियर हो जाता है। Now next question is which of the following assessment finding is typical of extracellular fluid loss। अब यहाँ पे extracellular fluid loss है तो that means यहाँ पे क्या हो रहा है, हाइपोवॉल्यूमिया हो रहा है। सो हाइपोवॉल्यूमिया में मेनली यहाँ पे क्या होगा, सो राइट ऑप्शन यहाँ पे क्या होगा, सी ऑप्शन में क्या है यहाँ पे, रैपिड थ्रेडी पल्स। तो सिंपल सी बात है कि यहाँ पे एक्स्ट्रासेलुलर फ्लूइड लॉस हो रहा है तो वहाँ पे हाइपोवॉल्यूमिया हो रहा है, और जब भी बॉडी में वॉल्यूम कम हो रहा है तो वहाँ पे सबसे अर्ली साइन क्या होता है, वहाँ पे सबसे अर्ली साइन होता है रैपिड थ्रेडी पल्स, दैट इज टेकीकार्डिया होता है। नेक्स्ट साइन एंड सिम्टम इज हाइपोटेंशन होगा। उसके अलावा क्या होगा यहाँ पे, ड्राई माउथ, ओलिग्यूरिया, मसल वीकनेस, लेथार्जी, ठीक है। तो ये है इसके साइन एंड सिम्टम। नाउ नेक्स्ट क्वेश्चन इज if not corrected, dehydration caused by hyperemesis result in fluid and electrolyte imbalance. Which of the following sign indicate a problem other than dehydration? तो यहाँ पे राइट ऑप्शन जो है बी। तो सिंपल सी बात है, यहाँ पे डिहाइड्रेशन में संकन फॉन्टेनल होते हैं। सो बल्जिंग जो फॉन्टेनल होते हैं, बल्जिंग फॉन्टेनल किस केस में होते हैं, बल्जिंग फॉन्टेनल होते हैं तो इंक्रीज आईसीपी में होंगे, और उसके अलावा किस केस में होंगे, हाइपरवॉल्यूमिया में होंगे, ठीक है। तो यहाँ पे जो राइट ऑप्शन है दैट इज बी। द नर्स इन्फॉर्म्स, तो नेक्स्ट क्वेश्चन जो है, द नर्स इन्फॉर्म्स यू दैट एन 80-year-old मैन हु वॉज एडमिटेड फॉर सेलुलाइटिस seems to be depressed and mentions about passive suicidal thought. When you assess him, he sees ghost in the ward and expresses paranoid ideation against nursing staff. Which of the following assessment is most important to establish the diagnosis? तो इसमें बोले कि नेक्स्ट क्या असेसमेंट करेंगे यहाँ पे, तो नेक्स्ट जो यहाँ पे राइट ऑप्शन है, राइट ऑप्शन यहाँ पे है डी। सो इसमें क्या करेंगे हम, रजिस्ट्रेशन एंड शॉर्ट टर्म रिकॉल को चेक करेंगे। किस चीज़ के लिए, तो ये मिनी मेंटल स्टेटस एग्जामिनेशन में ही आता है, उसके कॉग्निटिव लेवल को चेक करने के लिए, ठीक है। तो इसमें मिनी मेंटल स्टेटस एग्जामिनेशन हम वहाँ पे चेक करेंगे। तो और मिनी मेंटल स्टेटस एग्जामिनेशन की जो टोटल स्कोरिंग होती है दैट इज 30। नेक्स्ट क्वेश्चन इज आयरन सप्लीमेंट्स आर फ्रीक्वेंटली रिकमेंडेड फॉर ऑल ऑफ द फॉलोइंग एक्सेप्ट। किस केस में नहीं देंगे यहाँ पे, सो राइट ऑप्शन है यहाँ पे डी। ऑब्वियसली बात है, पोस्ट मेनोपॉजल वुमेन में आयरन की रिक्वायरमेंट नहीं होती है, बिकॉज उनमें नीड नहीं होती आयरन की, ठीक है। तो मोस्ट कॉमनली बाकी जो ऑप्शंस है, जैसे प्रेग्नेंट लेडीज में हो गया, इन्फेंट्स एंड टॉडलर में हो गया, ठीक है, एंड टीनेज गर्ल में यहाँ पे आयरन की रिक्वायरमेंट रहती है, नीड रहती है, तो इसलिए यहाँ पे आयरन ज़्यादा इंपॉर्टेंट होता है, ठीक है, एज कम्पेयर टू पोस्ट मेनोपॉजल वुमेन के। क्योंकि पोस्ट मेनोपॉजल वुमेन में नीड कम हो जाती है आयरन की। नेक्स्ट क्वेश्चन इज व्हाट इज द फंक्शन ऑफ स्मूथ एंडोप्लाज्मिक रेटिकुलम इन द सेल। सो राइट ऑप्शन जो है दैट इज बी। तो सिंपल सी बात है कि स्मूथ एंडोप्लाज्मिक रेटिकुलम जो है वो सिंथेसाइज करता है लिपिड्स को, और जो रफ एंडोप्लाज्मिक रेटिकुलम जो होता है वो सिंथेसाइज करता है प्रोटीन को। सो दिस इज ऑल अबाउट।
Hi everyone, welcome to KANIKA'S Nursing Academy. I Ruchika Sharma. Now I am going to continue with the next question. So the next question is, which of the following clinical findings indicate the patient is experiencing hypokalemia? So the options are edema, muscle spasm, Kozumbur breathing and the abdominal distension. So the right answer is D, that is the abdominal distension.
अब यहाँ पे देखो जो कंडीशन दी है दैट इज द हाइपोकैलीमिया. सो इन हाइपोकैलीमिया व्हाट हैपन्स, अगर पर्सन में हाइपोकैलीमिया है तो इट कैन रिड्यूस द जीआई मोटिलिटी. अगर जीआई मोटिलिटी क्या हो रही है, डिक्रीज हो रही है, सो इट कैन कॉज द कॉन्स्टिपेशन. और अगर कॉन्स्टिपेशन हो रहा है सो इट कैन लीड टू द एब्डोमिनल डिस्टेंशन. सो द राइट आंसर इज डी, दैट इज द एब्डोमिनल डिस्टेंशन. Next question is, a 50-year-old client is being treated for congestive heart failure and the client's medical regimen consists of digoxin 0.25 mg per orally daily and furosemide, that is the Lasix, that is 20 mg per orally BD. So which of the following laboratory tests should the nurse monitor? तो सबसे पहले तो हमें पता होना चाहिए कि जो हमारे पास ड्रग है दैट इज़ द डिजॉक्सिन. ऑलवेज रिमेंबर जो डिजॉक्सिन ड्रग होता है दैट इज़ द ड्रग ऑफ चॉइस फॉर द कंजस्टिव हार्ट फेलियर. दिस इज़ द इम्पॉर्टेंट पॉइंट, राइट. जो डिजॉक्सिन होता है, अगर हम डिजॉक्सिन के एक्शन की बात करें सो इट इज़ द कार्डियक ग्लाइकोसाइड्स. कार्डियक ग्लाइकोसाइड. समटाइम यहाँ से क्वेश्चन आता है the main action of digoxin. So digoxin is the cardiac glycoside and it is the drug of choice for the congestive heart failure. अब यहाँ पे स्टेटमेंट में क्या बोला है, तो पेशेंट को फ्रोसेमाइड चल रहा है दैट इज 20 mg पर ओरली BD. तो कौन सी लेबोरेटरी टेस्ट हैं जो हमने नर्स ने मॉनिटर करके रखने हैं. सो ऑलवेज रिमेंबर जो लैसिक्स ड्रग होता है दैट इज द पोटाशियम डिप्लीटिंग ड्रग. पोटाशियम डिप्लीटिंग ड्रग. तो पोटाशियम डिप्लीटिंग है तो ऑब्वियसली पेशेंट को लैसिक्स चल रहा है, तो जिसकी वजह से क्या हो रहा है, पोटाशियम का लेवल लो हो रहा है, राइट. सो इन दिस केस व्हाट हैपन, ठीक है, तो पोटाशियम का लेवल कम हो रहा है. सो ऑलवेज रिमेंबर हाइपोकैलीमिया इंक्रीज, सॉरी, हाइपोकैलीमिया इंक्रीज द रिस्क ऑफ डिजॉक्सिन टॉक्सिसिटी. मीन्स अगर पेशेंट में ऑलरेडी हाइपोकैलीमिया है और हम पेशेंट को डिजॉक्सिन ड्रग दे रहे हैं सो इट कैन कॉज द डिजॉक्सिन टॉक्सिसिटी. सो द राइट आंसर इज सी, नर्स शुड मॉनिटर द पोटाशियम लेवल. नेक्स्ट क्वेश्चन इज, a nurse had just started her rounds delivering medication. A new patient on her round is 4-year-old boy who is non-verbal. The child does not have any identification. What should the nurse do? So if the child does not have any identification, so obviously the nurse should contact the care provider. So the right answer is A. Nurse should contact the provider because child does not have any identification. Next question is, you are seeing a patient for preconception counseling and she has complex cardiovascular problems for which she will be seeing the cardiologist next week. She is concerned that her cardiac disease may lead to cyanosis and which cardiac diagnosis exempt her from this complication. So always remember VSD and PDA both are the acyanotic, both are acyanotic congenital heart disease, right. But tetralogy of Fallot, it is the cyanotic heart disease. And the Marfan syndrome, the Marfan syndrome is the congenital connective tissue disorder. So here there is lead to cyanosis. So obviously the right answer is the tetralogy of Fallot. Next is, what is the maximum duration of time the nurse allow an IV bag of solution to infuse in a patient? So the standard time is 24 hours because according to the government guidelines IV bag solution should be infused up to only 24 hours because it can increase the risk of invasion of microorganism. Means if we can use more than 24 hours, so it can increase the risk of infection in the patient. Next question is, a nurse is caring for the following client. Which client is the priority to be assigned to a private room? A client with, so the right answer is D, that is the pneumonia. Why? Because pneumonia is an airborne infection. Scabies, in scabies also we have to assign a private room for the patient. Means patient with scabies we have to assign a private room because it is also the contagious condition. It can spread from one person to the another person, right. But the priority nursing action is for the patient with pneumonia. Next question is, major epidemics of influenza A occur at the interval of, that is 2 to 3 years. Next, which of the following is not a side effect of the cholinerceptor blocker, that is the atropine. So if we talk about the side effects of the atropine, so that is the, always remember atropine is the mediatric drugs. So mediatric drugs means it can dilate the pupils, and the other side effects are constipation, tachycardia, urinary retention, drowsiness, dry mouth and nausea. So here the question is asked, not a side effect. So that is the diarrhea, because it can cause the constipation. So right answer is C. Next is, narcolepsy can be explained as. So if we talk about the meaning of narcolepsy, so narcolepsy is the excessive daytime drowsiness, right? So the right answer is D, that is the overwhelming wave of sleepiness and falling asleep during the daytime, that is narcolepsy. If we talk about the first option, that is a sudden muscle weakness during exercise, so the condition is called fatigue. Stopping breathing for short intervals during sleep, and the condition is called obstructive sleep apnea. And the third option is frequent awakening during the night, and the term is called insomnia. Next question. A research team measured ambient noise level in a patient room's, patient stress level and the duration of visit by the family and friends. They found that high ambient noise was associated with high patient stress and short family visit. So this is the example of which type of study? So this is that example of correlational study. So what happened in correlation study? Researcher used correlation to see if the relationship between two or more variables exist, but the variables themselves are not under the control of the researchers. So the right answer is A. Next question, who used microscope first time to view individual cells? So the right answer is Anton van Leeuwenhoek. Next question, immediately on the arrival of premature baby to the neonatal intensive care unit, the nurse should do which of the following? So here the question is arrival of the premature baby, right? So the priority nursing action is obviously check the airway for the patency. So first priority we will given for the airway and the breathing. So the right answer is C, priority action to check airway and breathing. Next question is, gray baby syndrome seen in infant characterized by progressive abdominal distension, pallor, cyanosis and vasomotor collapse for 3 to 4 days are associated with use of which drug? So the correct answer is chlorphenicol. Always remember gray baby syndrome. Gray baby syndrome is due to the toxicity of antibiotic, that is the chlorphenicol, right? So the main silent symptoms of gray baby syndromes are progressive abdominal distension, pallor skin, cyanosis and vasomotor collapse. So the right answer is C. Next question is, identify the instruments. So the picture is this. So this is the colonoscope. So colonoscope instrument is used for the examination of the colon. So next one more question is, यहाँ पे क्वेश्चन आता है कि कोलोनोस्कोप, जब भी हम कोलोनोस्कोप करते हैं तो वहाँ पे हम पेशेंट को कौन सी पोजीशन देते हैं? तो ऑलवेज रिमेंबर फॉर द कोलोनोस्कोपी द पोजीशन इज सिम्स पोजीशन. Next question is, a nurse is caring for a client admitted with Lanic cirrhosis. Which vitamin supplement may be necessary to include? Always remember, Lanic cirrhosis is the type of cirrhosis of liver, and it is the most common type of cirrhosis of liver that occur in the male. Sometime examiner can ask the question which is most common type of cirrhosis of liver in male. So that is the Lanic cirrhosis, or we can say that alcoholic cirrhosis, right? So which vitamin supplement may be necessary? So that is the vitamin B1. Another name for vitamin B1 is thiamine, right? Why vitamin B supplements are given? Because Lanic cirrhosis, also known as alcoholic cirrhosis, as I have discussed earlier, and in this what happened, there is impairment of the intestinal thiamine absorption by the ethanol. So the thiamine absorption proper नहीं हो रही है, due to this deficiency, to prevent from the deficiency of thiamine, we will give the vitamin B1 supplements to the patient. Next question, which of the following personality disorder is least likely to be considered as differential diagnosis to schizophrenia? So the right answer is obsessive compulsive personality disorder, because OCD is not related to schizophrenia. Next question is, identify the instruments. So the image is this. So this is the image of mammography. So mammography machine is used for, in this mammography machine the x-rays are used for the examination of the breast to diagnose the and for the treatment of disease. So mainly mammography machine or mammography examination is done to detect the breast cancer. Next question is, which of the following is not true of chickenpox? So if we talk about the causative agent of chickenpox, the causative agent for the chickenpox is the varicella zoster, and the varicella zoster is the DNA virus, that is not RNA virus. So here the question is not true of chickenpox. So right answer is by RNA virus, because it is the DNA virus. Next question is, which of the following are not treated with dexamethasone? So as we know, dexamethasone is the steroidal drug. So here the question is not treated with steroidal drug. So not treated with, first one is the inflammation. So obviously inflammation is treated with the steroidal drug, right? Sorry. So inflammation is not treated with the, inflammation is treated with the dexamethasone, that is the steroidal drug. Asthma is also the inflammatory disease. In Addison disease also steroidal drugs are used. Next is the Wilson disease. So Wilson disease is the inherited metabolic disorder. In this what happened, there is metabolism of copper not occur, means there is excessive accumulation of the copper in the body. So due to this what happens, they are not treated with the steroidal drugs, they are treated, the drug of choice for the Wilson disease is the penicillamine. Next question is, all of the following are types of conflict except, so intrapersonal, interpersonal, intragroup, all are the types of conflict. But the manifest are not type of conflict. So manifest indicate the appearance of sign and symptom. So the right answer is D. Next is, synthesis of large molecule from smaller molecule is known as. So the right answer is A. A nurse is using the Glasgow Coma scale to assess a client who had a head injury. During the assessment, the following is observed: eye opens to speech, motor response appropriate, client obey the command, and conversation is confused. The client should receive a score of. So here he is talking about the Glasgow Coma scale. So if we are going to scoring, so first one is eyes open to speech. So if the eyes open to speech, we will give the 3 score, that is 3. Next is motor response appropriate, client obey the commands, and conversation is confused. So for the motor response appropriate and client obey the commands, we will give the score is 6. Next is conversation is confused. So for this the score is 4. So total is 13. So right answer is 11 to 13, right? Right answer is 13. So here is the Glasgow Coma scale. So always remember, if the minor score is between 13 to 15, so there is minor brain injury. Then if the score is 9 to 12, then moderate brain injury, and if the score is 3 to 8 point, then there is severe brain injury. So maximum score of Glasgow Coma scale is 15 and the minimum score of Glasgow Coma scale is 3. And in eye opening response, the maximum score is 4. In verbal response, the maximum score is 5, and in the motor response, the maximum score is 6. So this is the Glasgow Coma scale. Next question is, during the data collection phase, researchers do all of the following except. So that is analyze the data, because During the data collection phase, implement the research plan is also done, then collection and record the data is also done, and consent is also taken from the sample. But the analysis of the data is done after the collection of data. So researchers do all of the following except. So right answer is C. So the next question is, which of the following is not considered as meta-paradigm of nursing? So there are total meta-paradigm of nursing, that is the person, environment, health and nursing, but the diagnosis is not meta-paradigm of nursing. So the right answer is D, that is the diagnosis. Next question and the last question is, which philosophical thought state that ultimate reality is spiritual rather than physical, mental rather than material? So the right answer is the idealism. So idealism is the philosophy that describes that the current situation is shaped into by our thoughts, and the realism is independent of our thought but it is the existence. Next is pragmatism. So pragmatism is the approach to things that focus on the practical or the logical response, and the last term is constructivism. It is the theory in education that recognizes the learner's understanding and knowledge based on their own experience prior to entering the school. So this is all about the scholarship test. Thank you.